Okay, so I got a package delivery. I think I know who it's from, but I'm gonna do a quick unboxing real quick because I can't wait to open it. Welcome to the video, by the way. I hope this video is finding you guys happy and healthy. Rip this baby open. I'm doing an unboxing. Yes! This is what I thought it would be. They have arrived and they sent me 2 boxes. Oh, and a little note. Oh, that's so neat. Look at that. Thank you for spreading the word and being a Keto Baker fan. Enjoy this carton on us. Oh, so nice of them. So if you follow on Instagram, you know that I did a story recently. I went to Costco about a week ago now, and I had never seen these before. And I got very intrigued by seeing them. I was like, oh my gosh, I gotta pick one up and try them. And they're delicious. And so apparently I was the first one to tag them in an IG story because I guess I was the first one. They sent me free boxes. So yeah, you can buy these at Costco. I don't know where else you can buy them, but it's called the Keto Baker and they're like layered brownies. There are 2 different kinds. There's an almond kind and a peanut butter kind. It's really neat because when you first open the box, it says, hello, sweet thing. I just love that. So this first one is the almond one, and the second one is the peanut butter one. And they told me, hey, bud, you was down here. They told me to bring this second box to work with me so I can share it with all the other nurses I work with and coworkers, which it is a really convenient snack. So I really like their ingredients in these. Almond flour is the first ingredient, so it is low carb, low sugar. Total sugars are 1 gram. And they're just these little nice, cute little snacks. They're 120 calories each. If you just need to like grab and go, little snack, this would be perfect at work because everything's on the go at work. I can barely sit down to chart, let alone sit down for a break. So I am very happy to bring these to work with me and share them with my coworkers. Thank you so much to the Keto Baker for sending these to me. And yeah, I'll keep spreading the word about your company. They are a brand new startup company and they pride themselves on low sugar, low carb, good ingredients, snacks. So far I only know of this snack, but I'm sure they're coming out with more stuff. This is what they look like. Little brownie squares. And they're very fudgy, and then there's peanut butter in the middle on this one, and there's almond butter in the middle on the other one. Do you like these?
They're good.
Oh. He likes them too. We just really try not to eat very much sugar in this family, and so if we can have snacks that are low in sugar but also taste good and are sweet at the same time, because I have a sweet tooth, it's just A+ in my book.
I'm lost in your energy. You got me feeling weightless, no gravity. I feel so high when you look at me. Caught up in your sweet, sweet fantasy. Oh my God, it's so electric, unexpected, oh. Oh my God, this feels so reckless. Drop my defenses. You got that good vibe. You give me that.
Such a good workout. I was so excited when this rower came in a couple days ago, arrived on our front porch, and I never thought I would get one. I've been wanting one for years. They're very expensive, so I really just never thought I would get one. And Josh surprised me for Christmas. Well, kind of a late Christmas present. We didn't get each other Christmas presents this year because, I don't know, money's tight with our renovations and stuff. So I wasn't expecting this. And oh my gosh, you guys, what a treat. I know I'm weird. I just think that really nice exercise equipment is such a treat. But it was really nice to work out in the heat, you know? Got the heater going, not in my freezing cold garage like I normally have to do. And then I just laid out my exercise mat. Yuma already took one of my shoes. And then did some kettlebells. So it was great. This was awesome. Also, a lot of our stuff off Amazon is coming in because we're furnishing our unit now. The last unit we've renovated. By the way, it's actually right here, our unit that we just renovated. The last one of the 4 units. All our shoes, some Amazon boxes. If you see like random boxes everywhere, it's because stuff's coming in to furnish that unit for Airbnb, which should be up by the end of January and definitely by February. So this is actually a couple days after my unboxing of those keto brownies. I just came off of a couple days of work and I am exhausted. That rowing workout really helped, kind of lifted my spirits, but the main reason why I wanted to jump on to YouTube and do this video was to kind of express how exhausted I am as a nurse right now in this pandemic. I think I'm gonna do spaghetti squash for dinner tonight. Also, I've decided today that my carbs have been a little out of control lately. I just haven't really been paying attention to what I've been eating, probably because I've been stress eating. So I think I'm gonna do tomato sauce, my favorite tomato sauce of all time, spaghetti squash. I think I have some ground lamb in the fridge. Yes. So I'm gonna cook this up, put it in the sauce, oven bake my squash. Yeah, so last 2 days of work were horrific, you guys. We have no staff. We literally have no staff. Just to give you an example, so there's a patient in our unit. By the way, those of you who are brand new, I am a ICU nurse, and pre-pandemic, I normally recovered open heart patients right out of the OR, so I'm a cardiac ICU nurse. But since the pandemic started, now we're going on year 3, I'm more of like a medical ICU nurse because I take care of a lot of COVID patients too. When the pandemic first started, they stopped doing all surgeries and then they picked them back up because COVID was getting more under control, and now they've stopped surgeries again because COVID is out of control, thanks Omicron. So because the general public is getting COVID, like everybody's getting COVID right now, so are the nurses. And so are all the staff in the hospital. Like, we are bare bone skeleton crew, and I've never seen this before. I've been a nurse 14 years now, and we're always short staffed. I feel like there's always a need for nurses, there's always a need for CNAs, any type of healthcare worker, there's always a need for. But this is just something I've never seen before. Just to give you guys an example, so I had a patient the other day who needed dialysis, and there were no dialysis nurses. There were 3 in the whole county. There are actually currently still 3 in the whole county. This was 2 days ago, and yesterday he finally got his dialysis treatment. He had to skip his dialysis treatment because there were no nurses. So the kidney doctor came in and took a look at him 2 days ago when he was supposed to get his treatment and was like, well, the order's useless. The doctor's order is useless when we have no nurses to do it. That is how bad it is. So luckily he was okay to skip his treatment. I mean, okay, he really needed it, but there were other patients that needed it more than him. So we have to prioritize which patients get dialysis, and that is the case with everything right now. They have to prioritize who gets emergency surgery, who gets elective surgeries. Like, there is just nobody. And so my 2 work days that I just had was horrendously difficult because we just have no help. So it's just me and my coworkers luckily for now, we don't have unsafe assignments yet. So when you're an ICU nurse, you only have 2 patients max. We haven't gone to the 3 patients or 4 patients yet, but that's coming. We had no charge nurse for the past 2 days. We had no break nurses, which that's common, but we had no leadership whatsoever, like nobody. And it's really scary when I come out of my patient's room. So I had a 450-pound lady with a lot of skin problems on her backside. She's bedbound and she was in poop. And I need 4 people to turn her. So I go outside of the room and look for somebody to help me. I need more than one person. I need at least 3 more people. Nobody. There's nobody in the nurse's station. Nobody to help me. All my coworkers are swamped with their assignment and how busy they are. And I had to leave her in her poop for a long time, for hours. I can't turn her myself. I mean, so it's just really, really hard right now to be a bedside nurse. So you guys already know that I'm burned out as a nurse. I've said this a lot on my Instagram that like my joy and happiness as a nurse is gone. There was also an incident last week that I was partially blamed for that I shouldn't have been blamed for at all. Sometimes what happens is when there's something unexpected that happens to a patient, the bedside nurse is the first one to get blamed all the time. 100% of the time, the bedside nurse is the one to get blamed. Even if it's a physician mistake, this is what it was, they always circle back to the bedside nurse and be like, well, what did she do? What happened? What initiated the event? Like, how was the patient at the beginning of the shift? What was the nurse doing? So that happened last week. I'm not really gonna go into it. I was already really burned out to begin with pre-pandemic, and then the pandemic hit and I was actually hanging in there okay, but now that with no staff, my work calls me 3 times a day to come into work. And I'm just like, I can't. Like I'm already tired. I already can't do my own shifts, let alone extra shifts. I guess I say all this to say that just make sure your guys are taking care of yourself. You do not want to be in the hospital right now. If you do go to the hospital right now, you'll wait in the ER forever. If you do get admitted, you'll get taken care of. We do our best, but it's not gonna be like the quality that we want. And I'm such a perfectionist and I wanna give like the best care I can, and I can't right now because there's just nobody to help. Get the COVID vaccine like I always preach. If you get COVID and you're fully vaccinated, you'll be okay. That will most likely keep you out of the hospital. Lately, I've been really struggling with my mental health. If you guys are struggling mentally just because this pandemic and everybody's getting sick, and if you're sick with COVID or trying to recover, you are not alone. This has been really hard the past couple of weeks for me. Just as a nurse, just knowing that a lot of my family has COVID. Honestly, you guys, I hate my job. I have such bad anxiety before I go to work. It's getting out of control, my anxiety level. So I'm actually looking for other jobs. I was trying to hang in there at the bedside in the hospital because I didn't want to be one of those nurses that are leaving the bedside, because thousands are, but I can't hang in there anymore either. I need to look out for myself, and I am looking for other nursing jobs. I would ideally like to leave the bedside and be like an urgent care nurse or like outpatient clinic type thing. A lot of it is the hospital I work in underpays us compared to the rest of the hospitals around my hospital. So I'm actually looking for other jobs at other hospitals, and it can be ICU still, it can be bedside, because at least I'd be getting paid a lot more for the torture that I go through. And this is bad timing because IVF starts in less than a month, February 13th, by the way, to be exact. But I honestly, you guys can't hang in there anymore. And according to Josh, I've been very difficult to deal with lately. And you know how sometimes you don't really know how difficult you are because like you're yourself, so you can't really see yourself outside of yourself, if that makes sense. You don't really know how other people are perceiving you, and I apparently am way too anxious for him to handle. I am part-time too right now, and that's not even helping. I mean, maybe it's helping a little bit, but I still have the same amount of anxiety before I go to work as when I was full-time. And part-time as a nurse, 12-hour shifts is twice a week that I work. So it doesn't seem like much, but it's still twice a week of going through hell. 12 hours is a long time to deal with chaos and no staff, no breaks. Yeah, that's my updates right now. I don't know how it's all gonna work out, but I've pretty much decided that I am going to put in my resignation to my job at the end of January. And even if I don't have another job lined up, I'm still going to put in my job makes me put in a 3-week notice instead of 2-week notice, but I'm going to put in my notice to quit January 31st, which is very scary because I don't think I've ever quit a job and not had another one lined up already. I'm not too nervous about it because there's so many positions out there, and worst comes to worst, I'll just get another ICU job at a different hospital that pays more. But yeah, I'm struggling, you guys, mentally, really struggling. So if you're struggling too, hang in there with me. I don't know, it's really one day at a time for me, and I don't really have much advice other than to just really keep yourself your priority and know when your mental health is going down and try to do some interventions. Meditation's always good, going for walks. Like I have Yuma, my puppy, so I cuddle with him a lot. That's really been helping. You know, talking with my family. I have a really good support system with my husband. I have 3 younger sisters that are really good support for me too, and my parents that I call them a lot. So, you know, just knowing your limitations, and don't be afraid to stand up for yourself and to know when enough is enough. I'm a little bit scared to try something new. I've been an ICU nurse for a very long time, and I take pride in what I do, and it's taken me a long time to get to where I am skill level wise. I know being an open heart recovery nurse in the ICU is basically like the highest skill level you can have. So yeah, I thought I would update you guys on what's mentally going on with me right now. Really struggling with my mental health and nursing in general. I am determined to find my joy and happiness as a nurse again. I don't know how that's going to work out, but I'm so thankful that I have my husband, I have my 4-plex. We're getting our Airbnb up and running soon, so that will bring in some extra cash flow, so that will help kind of float us until I get another job. It's just difficult, you guys. This whole thing is just, I can't believe we're going through it. Like, I thought the beginning of the pandemic was hard. This is harder. This is way harder. All right, I'm gonna cook some dinner up. If you wanna watch me cook some dinner, I'm going to record it. And this is actually one of my favorite dinners that I make. It's so easy and it's just really tasty. I love it. It's healthy. Enjoy me cooking dinner and the B-roll. I'm gonna end the video here. Thank you so much for watching. This is kind of a random video, but I really wanted to kind of like express how I'm feeling these days. If you want to leave a comment down below if you're struggling mentally with this pandemic, if you're sick with COVID, if you know a lot of people sick with COVID, feel free to comment down below and yeah, express how you're feeling. I do get back to every single comment. I try my best anyways. I think that's really important. And thank you so much for watching. Give this video a thumbs up if you liked it, of course. And always remember to be kind to yourself.
Oh, I'm ready. I've never been so sure, quite so steady. I'm gonna live my life to keep the promises I made. Even though I make mistakes, I know I'm ready. I found a heart that was just like mine. Yeah, I found a heart that was just like mine. It's the kind of love that can make you blind. And I'd do anything to see him smile. Oh, I'm ready. I've never been so sure, quite so steady. I'm gonna live my life to keep the promises I made. Even though I make mistakes, I know I'm ready. I found the heart of my best friend. It's the kind of